My name is Mark Bradford. I'm a resident in internal medicine at the University of Rochester Medical Center. I recently published a paper in the Annals of Internal Medicine on the effects of levamisole in cocaine and vasculitis. So I was on the hematology service when we were consulted for an elderly African American female who had presented to our hospital with vasculitis in the setting of cocaine use and become neutropenic 2 days into her stay. On physical exam, she had raised purpura on her cheeks and bilaterally on her ears, and on her cheek showed areas of central necrosis. A thorough workup was done for her neutropenia and her vasculitis, the biopsy of which had showed microscopic polyangiitis. It wasn't until 2 weeks later that I had heard of a second case that presented to our hospital, again with vasculitis, areas of purpura with central necrosis on the nose, cheeks, and bilaterally on the ears, with consistent biopsy results of microscopic polyangiitis. This patient had also had neutropenia, and doing further research into the two cases, trying to link them, I was able to find the connection between levamisole in cocaine and associated neutropenia. Going back through the literature to see how levamisole had been used in the past, I found several case reports describing this exact same vasculitis, areas of purpura with central necrosis, usually on the cheeks and on the ears. Levamisole has historically been used as an immunosuppressant in several diseases, including colon cancer, pediatric nephropathy. It has since been replaced with drugs that work much better and have a higher efficacy. It is also still currently being used as a veterinary dewormer. Why it is being put into cocaine is really just supposition, since we are not able to talk to the people putting it in cocaine. It is assumed that it's being put in either as filler or because it increases the euphoric effects of cocaine. Based on numbers coming out of the CDC, it is supposed that approximately 70% of cocaine out in the community now is tainted with levamisole. So the side effects that we know that levamisole can cause include weakness, fatigue, a flu-like illness, mild symptoms such as those all the way up to severe agranulocytosis, respiratory problems. The agranulocytosis actually is self-resolving with withdrawal of the drug. The incidence of levamisole-induced agranulocytosis in the literature ranges anywhere from 0.4% to 20%, depending on the series that you're looking at. Unfortunately, that is when levamisole is being used for medicinal purposes. We don't know how much exposure these patients using cocaine are getting to the drug or the frequency of their exposure. So it would be very difficult to extrapolate any kind of incidence for this in that population. In terms of the vasculitis effects, really there are just case reports with no established incidence for that I know of. So I think the most important takeaway points from these cases is one from a physician perspective, to always ask about the social history of your patients and different illicit drugs that they may be using, but also from a patient perspective to be open to telling your physicians when you're using something like that, knowing that your physicians are there not to judge you, but to put together the pieces of the puzzle and to help you solve the medical problems that you're coming in to deal with.